Hello, my name is Catherine Smith. I'm an Indiana State University nursing student in the LPN to BSN program, and I will be discussing healthcare-associated infections today. The PAR, or the population at risk, are all hospitalized patients, regardless of ethnicity or social economic status. Learning objectives. You, the learner, will discover the current extent of the problem. We'll recognize risk factors for healthcare-associated infections. We'll recognize common types of healthcare-associated infections acquired by hospitalized patients. We'll identify ways that healthcare workers can prevent healthcare-associated infections. And we'll be able to describe how patients can help guard themselves against healthcare-associated infections. Please pause the video for a brief pretest. Click on the link below or go to this address. Welcome back. In case you did not notice, there is an outline available below next to where you clicked for the pretest. You can download it and follow along if you would like. It also includes a list of resources available. Healthcare-associated infections, or HAIs, are infections acquired during medical or surgical treatment. The Office of Disease Prevention and Health Promotion has identified HAIs as a Healthy People 2020 topic due to the prevalence of HAIs and the fact that many of these infections are preventable. According to the Office of Disease Prevention and Health Promotion, patients can develop an HAI while undergoing regular medical treatment or surgeries. Research has identified the development of HAIs in a number of healthcare settings, including long-term care facilities, nursing homes, family practice clinics, dialysis clinics, and home care settings. For the purpose of this presentation, we'll be looking at HAIs in the hospital setting per the PAR. Healthcare-associated infections can have devastating effects on hospitalized patients. Acquiring an HAI can result in serious illness, lasting physical harm, or even death. Patients will likely see an increase in their hospital stay length, which could lead to emotional and financial hardship for the patient. Per the CDC, data shows that approximately 1 in 31 hospitalized patients per day in the United States acquires an HAI, which is about 1.7 million hospitalized patients annually. Sadly, about 1 in 17 die as a result of acquiring an HAI, which is more than 98,000 patients annually. To put this in context, the United States Department of Transportation reported approximately 37,000 deaths from traffic crashes in 2018. In that same year, there were more than 2.5 times the number of deaths due to HAI. Especially vulnerable to HAIs are patients with weak immune system, like those with autoimmune conditions, cancer, and critically ill patients. HAIs also add billions of dollars in cost in the healthcare system and to their patients. Risk factors for HAIs include hospitalization, surgery, use of catheters such as urinary catheters and intravenous catheters, endotracheal tubes, insufficient disinfectant of hospitalized environment, and failure to wash hands or use appropriate sterile techniques when delivering care by medical personnel. Another risk factor is the overuse of inappropriate use of antibiotics. Per the CDC, many HAIs are now caused by the development of supergerms, which are pathogens that are not easily killed by standard antibiotic treatment and require special and often extensive courses of antibiotics to treat. Common types of healthcare-associated infections resulting from these risk factors include bloodstream infections, pneumonia, surgical site infections, urinary tract infections caused by the use of urinary catheters, referred to as CADIs, and an infection by an organism called Colostrum difficile is often referred to as C. diff, which spreads easily and causes severe diarrhea. The Office of Disease Prevention and Health Promotion outlines several ways that healthcare workers and providers can reduce the risk of healthcare-associated infections. These include proper hand hygiene, utilization of appropriate personal protective equipment, which can reduce the spread of supergerms like C. diff between patients, appropriate use of antibiotic, and the use of sterile technique for the insertion and maintenance of invasive catheters and tubes. This simple infection control practices like hand washing significantly decreases the risk of HAIs, which can save lives. Patients can also make efforts to safeguard themselves against HAIs. The CDC suggests that patients also practice good hand hygiene. Patients should participate in discussions with their provider about their medical treatment. The CDC also encourages patients to ask their providers if antibiotics are necessary for them and to take antibiotics exactly as the provider has ordered them and for the full course of the treatment. Patients should also acquire preventative vaccines when available and appropriate. While hospitalized, patients should be vigilant towards their care and be understanding of practices such as use of PPE by hospital workers and regular room cleanings by environmental service workers. For more information, you can visit the sites below. They are also provided on the handout. This concludes my presentation. Please take the post test, click on the link below, or go to the address at the bottom of the screen. And thank you for watching.